Good afternoon. Thank you for attending today. My name is Teresa Novakovich. I'm a health education coordinator with South Central Alaska Area Health Education Center. We are a workforce development department of the Alaska Primary Care Association. And this is session 10 of Professionalism in Healthcare, our Brown Bag series. So thank you for attending today. If this is your first time or your 10th time or anywhere in between, we're so happy you could be here and hope that you will find this information useful and beneficial to you and your organization today. So what we're going to talk about today is communication. Communication can be something that makes or breaks us as an organization, as a family, as a community. A lot of our problems and our challenges can be traced back to a lack of communication, poor communication, or a breakdown of communication. So learning about effective communication skills, having some tools in your toolbox to be good at communicating is going to be beneficial for us in all aspects of our life. And that's what we're going to talk about today. So as you can see from this picture here, most of what we communicate is not in the words that we speak. They say that almost 90% of communication is nonverbal. Our tone of voice, our facial expressions, our body language all communicate a message that is actually louder, figuratively louder than the words that we say. Just looking at the picture there on this PowerPoint slide, there's no words, there's no text, but it can convey a lot of meaning. They say a picture is worth 1,000 words, and we can see that in this picture here. There is a communication going on, but it's not spoken words. The basic elements of communication are a message, some information that we want to share, we want to disseminate, we want to teach. There's a sender of that information, a receiver of that information, and then of course feedback. Sometimes we forget that feedback. If you've ever sent a text message to someone, sharing information and not received anything back, you can kind of imagine not knowing if your communication is effective. So getting feedback is a critical part of effective communication. We're going to talk about, first of all, communication in the workplace, specifically between coworkers, colleagues, supervisors first, and some barriers to that communication and some ways to overcome those barriers and be effective. So barriers to communication, there can be a wide variety of them. Prejudices can be a barrier to good communication, and that's something that Mari Sell, our director, talked about Monday on our Brown Bag webinar. If you were there, it was excellent. So our prejudices can be explicit, something we're aware of, or they can be implicit, things that we're not conscious about but can affect the way that we communicate or understand those around us. Frustrations. Frustrations, being impatient, being annoyed, being angry can interfere with the way that we communicate. Another barrier can be life experiences. If we don't have common experiences with the person that we're communicating to, that might lead to a breakdown of communication or a misunderstanding. To be an effective communicator, look for things that you have in common with the other person. Another barrier can be aging, just simply physical issues that come along with aging, a lack of hearing, or vision problems, emotional or mental issues can be a barrier to communication too. One aspect of communication that can really be helpful is emotional intelligence. Emotional intelligence has kind of been a buzz phrase for the last couple of years. You've probably heard it. If you haven't, the way I would put it in my own words is emotional intelligence is awareness. Awareness of yourself and awareness of what's going on around you. For example, not too long ago, I was distracted worrying about something, and my husband came up to me and he said, "Are you mad at me?" And I was taken by surprise by that, because my distraction and being aloof because I was worried about something came across to him, communicated to him that something was wrong. And he didn't know if that was something that he had done, something that he needed to apologize for. But I wasn't very self-aware at that time of what I was communicating. So there's an example of poor emotional intelligence on my part, but being aware of how your actions, how your words, how your tone are presenting themselves to those around you is a part of that emotional intelligence. And then managing that, being aware of your emotions and being able to positively change your behavior if you need to, so that it doesn't interfere with how you're trying to communicate. So knowing when you're having a bad day and not letting that affect your communication with those around you. And social intelligence is also social competence, being aware of what's going on with the people around you, the people that you're communicating with, that you're serving, that you're working with. Are they having a bad day? Is something going on under the surface there that needs to be addressed that isn't being verbalized? My favorite example is this. If you were asking your parents for something as a kid or as a teenager, maybe you wanted to borrow the car, and you walked into the room where your parents were and were going to ask them, "Hey, can I borrow the car?" or "Hey, can you lend me 10 bucks?" And you felt something in the atmosphere and you just decided not to ask, like, maybe this isn't a good time for me to ask. That is high emotional intelligence. There was something going on that gave you those clues that wasn't a good time to ask for something. So that's being socially competent and aware of your surroundings and being sensitive to what's going on with the people around you. So conflict resolution, this comes up in a normal part of our work environment and our home environment. Disagreements are going to come up, how to approach a problem, difference of opinions, and there are different ways that we can resolve conflicts. The four categories that we can put styles, conflict resolution styles into are aggressive. So aggressive would be, it's my way or the highway. I think my way is correct and I'm not going to settle for anything less. Likely, a person who has an aggressive style is likely to confront or attack. A passive style is kind of the opposite of aggressive, someone who doesn't want any conflict, doesn't want to stand up for their thoughts or beliefs or desires, and is just willing to let everyone have their own way. So accepting without resistance would be a passive conflict style. Passive aggressive is where you're passive on the surface, but then aggressive underneath. So might agree with someone in a meeting and then undermine that decision later. And then assertive. Assertive is someone who's confident and self-assured. And if you haven't already guessed, assertive is the way that we recommend that you approach conflict, not being passive and letting people walk over you, not being aggressive and demanding, but being open and confident and assured. So an example, let me give you this conflict. Maybe this has come up for you in the workplace before. Let's say both you and a coworker want the same day off. For example, Christmas. Maybe you work in a facility where staffing is needed 24 hours a day, 7 days a week. And both you and a coworker have family coming into town. You want to spend time with them, but it's become clear that one of you is going to have to work on Christmas Day. Your supervisor has said, I'm going to let you work this out among each other. So how would you handle that situation? Think about that for a minute, and if you wouldn't mind, just putting it in the chat box. What would be a good way to deal with this conflict? Kaylee says, talking to the coworker, perhaps you could share it. Excellent idea. Diane, offer half-day shifts. Wonderful suggestion. Yeah. Someone who's been there longer. Maybe you could propose seniority. Yeah. Thank you, Kathleen. What I really appreciate about all these answers is that they're all logical, compromising solutions to the problem. Flip a coin, take turns, there you go. Yeah, so nobody's being like, it has to be my way, I'm taking the day off, or, well, you can have it. Trade holidays, there we go. That's from Dawn. This conversation should have started around Thanksgiving. Good point. Yeah. So an equitable exchange of shifts could have been worked out in advance. Love that. So let's address the problem in advance if we can. Thank you. So I hope it's obvious that the highest chance of a positive outcome is being assertive, not aggressive, but assertive, open-minded, and fair when we're trying to resolve conflicts. So talk about communication by phone and voicemail. So our communication needs to be professional. All healthcare settings require good telephone communication skills, especially if you're a frontline employee and you're answering the phone. Usually your employer will have a script that they want you to use when answering the phone that identifies yourself, identifies the organization, is respectful, kind, and helpful. It's important to have that type of communication on the phone. Avoid inappropriate words and phrases. And our voicemail, if you're in a situation where you're calling patients or clients and possibly leaving a voicemail, you want to leave a very professional voicemail, of course, following HIPAA guidelines, but letting that voicemail, the person on the other end of that who's receiving that message, who you are, what organization you're calling from, and a very polite message with a callback number, all of that key information that they need to know. If any of you have ever received a voicemail and the message is, call me when you get a chance, you know how frustrating that can be. That's happened to me. Even if you have caller ID, you might not know who called, you might not know why they called, where they called from, or a good number to call back. So think of that in our telephone communications, voicemail communications, to be very professional and leave all that appropriate information that needs to be left so you can continue that communication. On a related note, oh, Don, I just saw your note and I think this is important too. Please slowly articulate. Absolutely. I've been known to delete voicemails if I keep rewinding and I can't understand. I've had that same situation myself. And so what I do and what I would suggest is when you say your name, your organization, and your phone number, say it slowly at the beginning, and then I repeat it at the very end of my message. Again, this is Teresa Novakovic with South Central AHEC. Please call me at this number. So, all right. And I just wanted to mention our personal voicemail messages too. So your supervisor, your boss, your colleagues, your partners that you work with probably are going to be calling your cell phone occasionally. And just be aware of the voicemail message that they receive if you're not answering that phone, and make sure it conveys the image that you want to convey. I had a conversation with an HR manager not too long ago. They had a position open in their organization, and they had accepted resumes and had taken those resumes and they had put them in two piles. One, a pile of applicants who are not qualified for the position or not the most qualified, and then another pile of applicants who were qualified and that she wanted to interview. And the next process of that hiring was calling each one of those applicants where she wanted to interview and setting up an interview. And one of the applicants she called, she got a voicemail message, and the voicemail message simply said, "You know what this is, you know what to do." Click. That was the end of it. And for her, she felt that was not very professional. She wasn't sure if she had called the right person. And she just took that resume and put it in the no pile. So just be aware that what your voicemail says is a reflection of you, and make sure it's saying the message that you want to convey. It's portraying your image as you want to portray it. So the next type of communication I want to talk about is so relevant right now, and that is conference calls and video chats. It's become our new reality, and that can bring up its own set of challenges and etiquette. To introduce this topic, I have a really humorous video about conference calls. And as you watch this video, I'd like you to look in there and just come up with a mental list of do's and don'ts in conference calls and video conferences. What you see that works really well, what you see like, shouldn't do that, that is not very professional. So here we go.
Trip Crosby
has joined the meeting. Beth has joined the meeting.
Hello?
Tyler?
No, this is Beth from ICS.
Oh, hey, Beth. How are you doing?
Oh, good. Yeah. Just making it, you know.
Tyler?
Has joined the meeting.
All right, well, this is Trip. Who's here? Tyler's here.
Beth's here.
Okay, the purpose of today's meeting is to discuss the...
Yeah, I'll be able to do it in like 30 minutes. John?
Has joined the meeting.
Hi, John.
Hi.
I was just trying to go over the purpose of today's meeting, which is to discuss the deliver... Tyler?
Has joined the meeting.
Sorry, guys, I got cut off. Is Paul here? Send him an invite.
Put in your access code.
No, that's your PIN number.
It should be a 9-digit number.
Try pressing the pound key. Paul.
Has joined the meeting.
Any questions before we move on?
Yes, this is Beth. What's our best plan of attack for the second quarter?
Question
What we
actually...
should do.
Oh, go ahead.
Oh, I think
Well,
what we should do.
It
is
actually
really
depends on
diversify.
how you look at it, because the
really come.
Go ahead.
Go ahead. I think
Given
what we-
fails,
what
we're
we
out of
really-
the
Let me just say that
Okay.
was a great graph, John. Tyler?
Well, my main concern with the projections for year was that they're just insufficient. I mean, they're not even taking into account.
Did we lose Tyler again?
Hello?
John, are you guys taking distributions? John?
Oh, my bad. I was on mute. Let me start over.
So I've prepared a presentation. I'm sharing it with all of you. You should be able to see it on your screen right now.
Got it.
I don't see a link anywhere.
It says I need to download a plugin.
We are all using Macs, I'm assuming.
Yeah.
How can you?
Financials are looking great. Paul, do you have any comments on staffing?
I was thinking that because we get a few more contractor types in. I'm sorry.
Rex, get down.
No, tighten that up.
To me, staffing is a huge. Is that me?
Let me.
I just want to go over a couple of details as we move into our next section here. We got 3 new departments coming on.
Break it up a little bit, guys.
By the end of Q3.
I'm
So I need everyone to give me detailed evaluations each
Sorry,
month
guys.
so that we know. That's it, guys. Beth, you'll send out a recap email that could have basically taken the place of this whole meeting, correct?
Yep, always do.
Yeah, thanks for doing that, Beth. Dave, you've been here the whole time? Yeah. Huh. Well, thanks everyone once again. Oh, one more.
Okay. I saw experiences that I've had in the last couple of months in that video. I don't know if you did too, but from your own experiences, maybe things that you've seen in this video here, what are some do's and don'ts of conference calls and video conferences, or things that you've seen done that you're like, ah, that's a pet peeve of mine? Go ahead and put that in the chat box. All right, Kaylee relates. Yeah, coming into a conference call late, getting cut off, shouting instructions, talking to each other, not unmuting yourself, not keeping background noise to a minimum. Yeah. I'm glad you like it, Diane. Always use mute when not speaking. Absolutely. You know, sometimes there can be things in our background that aren't bothering us, but that can go through speakers and be really disruptive to a meeting. So we could be oblivious to it. And so just as good etiquette, mute your microphone unless you're talking. Join early to test the connection. Absolutely. Toilet flushing. Okay. Yeah. Person talking on mute for a long time. Happens to the best of us, being in a room with distractions. A lot of people have something in the background going on, making sure that nothing is disturbing. Awesome, thank you. And I just want to put in there, you may or may not be on camera, but I would recommend that you get dressed for any video conference, any telephone conference, and be in a professional setting as much as you can. You never know when you might be asked to chime in or to present something. And the way we are dressed and our surroundings actually affect the way we communicate. If we're in bed, you know, under the pillows with our laptop and we're not dressed, the tone of our voice and the way we communicate is actually different than if we're dressed professionally, ready to go and to handle anything that is asked of us, or available to share anything that needs to be shared. So I recommend staying dressed and being as professional as you can, even in a Zoom meeting. Okay. Thank you, Renee. Renee said she was in a meeting and somebody else's dog barked, made her dog start barking. And so it's kind of embarrassing. Yeah. Thank you, everybody, for sharing those. Okay. I'm going to ask you a question. How many of you feel comfortable striking up a conversation with somebody you don't know, somebody you haven't met before? I've got a poll I'm going to launch right now. And just go ahead and answer that. Okay. Give me just a couple more seconds to vote if you haven't. All right, so it looks like most of us, 50%, are fairly comfortable doing that. 17% don't really enjoy it, but they can do it if they need to. 11% way out of my comfort zone. And then there's the 22% who have no problem talking to someone that they don't know. Oh, sorry, Mary Lou. If you want to put that in the chat box, you can share your level of comfortableness with striking a conversation with somebody that you haven't met. So I wanted to talk just briefly about the importance of networking. Networking involves developing relationships with people who often become your friends and a community of colleagues as you go through your career. Networking is stepping out of that comfort zone and striking up a conversation with somebody you may not know. It could be in a formal setting, a formal networking meeting, or it could be informally, somebody that you meet at the grocery store or at the post office. And in our current situation, it could be somebody you meet on a virtual meeting like this. I like to think that right now I'm networking with all of you and developing relationships, and you'll get to know what I do and what my organization does. And if you have a need in the future for what we do, you'll be able to reach out to me. So it's definitely a two-way street. Networking isn't just going out and meeting people to see what they can do for you and how they can advance your career, but it's also seeing how you can help other people, what skills and talents and abilities you have that may fulfill a need that they have. And it's very powerful. So many people have told me stories about incredibly difficult problems have been solved by sharing that problem with colleagues and coworkers and being connected to people who were the answer to that problem. Most of the jobs today are acquired through networking. 70% are not even advertised, but they are filled either in-house or by someone who knows someone who referred them to a job. So networking, talking with people can really help you not only personally but professionally too. Another short video I want to show you just some quick tips on networking if that's something that you're uncomfortable with. Here's a couple of tips and tools for you.
Your brain and skills will only take you so far. To succeed in this world, you really need a network, connections with people who can help you achieve your goals. In fact, they say that you're the average of the 5 people you spend most of your time with. Luckily, it only takes the first 90 seconds or less to get them to open up to you, like you, and form a connection. Next time you find yourself in the typically awkward networking situation, focus on congruency. People notice your body language, eyes, and facial expressions. They all have to sync up so that you come across as authentic and trustworthy. Imagine if you ask someone, "How's it going?" and they say, "Oh, everything's great," while they're looking away and have their body turned to the side. Instead, make sure your body is opened up towards the person you're interacting with. You maintain good eye contact, without staring, of course, and make sure you smile. It's the easiest thing, and it has the biggest impact in starting a warm relationship, yet so few people do it. Once you've mastered these 3 small things, the next step is to mirror their mannerisms. If someone's a low talker, they won't connect easily with a loud talker. And when you only have 90 seconds to make the right impression, you want to connect as fast as possible. So make them comfortable by copying some of their mannerisms. These tactics will get the other person to open up and engage in discussion with you. Lead with open-ended questions where they can't give a sterile yes or no answer. Any question that starts with how, when, what, why, where, or how is great. Get them talking, because that's the only way to identify common ground. Listen carefully to find out what they truly care about, what's on their mind, why are they where they are, and what are they hoping to get out of it. Perhaps you can genuinely help, or you can make an introduction with other people you meet in the room, or you share an interest you can follow up on and deepen your connection. The good news and the bad news is that it only takes 90 seconds. The bad news is that if you don't click in those 90 seconds, you probably can't get a connection going. The good news is that with just a few simple tactics, you can prime your encounter to become a fruitful connection. It's easier and more important than you think.
All right, I would love to hear from any of you. If you have tips of networking, anything that you do that makes it more comfortable, or any success stories of problems you've solved, or situations that have been resolved because of your networking. If you could put that in the chat box, I would love to hear some of your tips. Be in the moment, Jenna. I really like that. Dawn says, it helps to know something about them to find common ground. Yeah, so if it's a formal networking meeting, or you know in advance who's going to be there, if you can do any homework and find out about the people that you're going to be meeting, that helps a lot. Maybe an observation about taste, their clothes, making observation. Love that jacket. Where did you get it? I noticed you were reading this book. How do you like the author? Yeah, make an observation. Excellent. Finding common ground. Thank you, Lori. Yeah. One thing that really puts me to ease when I'm in a networking situation is changing my perspective from I'm going into this trying to sell myself or trying to impress people. And instead of that perspective going in, I'm going to go in there and see who I can help. Maybe I have something, or I have some resources, or I know somebody that can help other people. And so if I take the focus off myself of being self-conscious and saying the right things and doing the right things and looking the right way and focusing on who is around here that I might be able to help, it reduces my anxiety quite a bit. Lori, when I have trouble getting someone comfortable enough to talk and hold a conversation, if you start by telling them a small story about yourself, people feel obligated to return the conversation. Great tip, Lori, great. Honest, thank you. All right. And another part of our communication at work is public speaking and presentation skills. Some people, this isn't a part of their professional life, but almost everybody will have the opportunity to do some type of public speaking or do a training for other employees. And so practicing that and being comfortable with that is a good skill for all of us to have. So when you're asked to speak in public or you're asked to do a presentation, some tips are to be as prepared as you possibly can. Do your research on the topic, practice your presentation, make sure that it's professional. If you have visual aids, make sure that everything is in order. You have all the materials you need, the content is correct, and provide a comfortable environment for the audience. In our current situation, that's usually virtual and not in person. But if you have in the past or in the future, maybe doing an in-person presentation, make sure that, you know, the room temperature is comfortable, and if possible, have water for the participants, and just make it an enjoyable experience for them. And I can tell you from experience, the more you do this, the easier it gets and the better you get at it. So if you say, I don't like public speaking, I wish I was good at that, but not my cup of tea, I would encourage you to take every opportunity that you can, every opportunity presented to you to give a presentation or speak in public, because the more you do it, the better you're going to get at it. And it's a valuable skill to have that your employers will really appreciate. So moving on from verbal communication to written communication. We might need to write reports, we might need to create flyers or announcements, and so we want to be effective in our written communication too. Some tips: keep your goal in mind. What is the goal of this paper that I'm writing, or this report that I'm writing? Make sure that the communication in that achieves that goal, addresses that goal. Knowing your audience, who are you writing to? Are you writing to the general public who might not be familiar with acronyms and medical terminology? If so, you want to adjust your communication to that level, because you want everybody to understand what you're communicating, what you're writing. Always use complete sentences, proofread your work, use spell check, but don't rely on it. I'm sure we've all had experiences with that. And use only standard medical abbreviations to avoid confusion. We can have acronyms and abbreviations that are specific to our organization that people outside might not know what they mean. And it's always better to err on the side of explaining and spelling things out than to risk the chance of somebody misunderstanding or misinterpreting what you're trying to say. Email communication. Email we use a lot. Has anybody been embarrassed by replying all to an email when they meant to just reply? If you could figuratively say yes or no. Mary Lou says she gave a presentation and the internet cut out in the middle of it. I felt I was doing fine until that happened. Then when I got back, I felt like it wasn't going as well because I was flustered. Mary Lou, that is absolutely not your fault, and that would have happened to anyone. Yeah, sometimes things are out of our control and you just think, okay, the show must go on. Let's pick up the pieces and do the best we can. But people are so understanding, and sometimes we might think that we're being judged or people are being critical if things don't go smoothly. And I found the opposite to be true. Everybody is on the same page and working towards the same goal, and very compassionate when things don't go the way they were planned. So I know some people who are not clear on the difference between reply and reply all in an email. So when you're responding to an email, there might be several people who are copied in that email. If you hit reply all, everyone that was copied, including the person that sent the email to you, will get a copy of your email. And you may or may not want that. So just be sure that if you hit reply all, you understand and you want everybody who was copied in the original email to get a copy of your response. Sometimes we do that by accident, and information that we didn't want to share gets shared. So in our email communication, choose your words carefully. Texting abbreviations, LOL, BRB, not appropriate in an email, in a professional email. Remember that any message you send is permanent and it may be forwarded to others. I would encourage you never to email something that there was somebody you didn't want them to see what you have in that email. In my experience, they'll see it. Even if you didn't send it to them, they'll see it. And so be professional, Be very careful with your words, and make sure that you're sending out accurate, professional communication that wouldn't embarrass you, no matter who saw it. Read your email aloud to check your tone of your message. Sometimes we know what tone we're conveying in our email, but when you read it, you can kind of go, oh, that sounds a little harsh when I didn't mean to. So that's a good way to check the tone. Proofread for spelling and grammar mistakes. And it's common courtesy, if possible, to respond to incoming emails within 24 hours. So if somebody sends you an email, even if it's asking you to do a project that might take several days, if you can respond within 24 hours and say, hey, I got your email, I'll get working on this, I'll keep you updated. That's the feedback in the communication, is letting them know, got your email, thank you, I'll keep you updated. So not hearing from people or not getting a response leaves everybody wondering. All right, some other tips when corresponding by email: slow down, think about what you're doing. Keep your messages short and to the point. In our business emails, nobody wants to read a novel. So edit and just convey the message that you need to without a lot of elaboration unless it's necessary. Be careful when forwarding messages. You may be forwarding information that isn't accurate or that shouldn't be forwarded. So just be very cognizant of that. Fancy fonts, smiley faces, emoticons, not very professional. I discourage you from using those in business emails. Remember, electronic communication isn't foolproof. I'm sure it has happened to you, it's happened to me. I have emailed people and then followed up, and they said they never got it, can't find it anywhere. And the same has happened in the reverse. People have emailed me. So following up and getting that feedback is important. Never send an electronic message when you're angry or emotionally upset. That opens up the door to say things that might come back to bite us or we didn't really mean. So I've heard of a lot of people say, give it a 24-hour time frame before you respond when you're angry or upset, to really think about the message that you want to send. And remember that electronic communication leaves a documented trail of messages. So once you send a message, even if that person deletes it, it isn't gone. Emails can be retrieved, be used for evidence or to support an argument. Again, make sure that you're aware of what you're emailing and it's saying what you want to say. So I've got a short activity for you. I've got some bad emails here. I just like to pull up a couple of them and have you look at that, and then type in the chat box what you feel is wrong with this email in a business setting. So here's our first one. Might seem harmless, but if you received this from a coworker, would you think there's anything wrong with that? Lori says, carbon copy, too many people CC'd. Yeah. Okay, Kathleen says, I've learned to delete those emails, may contain a virus. Last sentence is missing a word. Yes. Dawn's our proofreader there. Yeah, good one, Dawn. Hope you it. I would delete it. Too many forwards, too many typos. OMG doesn't need to be there. Yeah. So, why sending non-work items on a work system? Exactly, Dan. I'm sorry, Don. I'm sure you get these all the time. I get these. I have a father-in-law who loves to forward me forward to forward to forward to forward, and you know, they're cute little stories or pictures of cute little animals. One thing, it could have a virus. It's unprofessional and it has nothing to do with your work. So this isn't appropriate for a work setting. And I would be leery of forwarding things like this, even in your personal life, because you never know the validity of the information that you're forwarding, or if the person is even interested. Email is not professional, absolutely. Thank you. All right, here's another one. Might be a little harder to find the problem in this email. It looks kind of professional. Tell me what you think. Okay, Lori says there's no attachment there. Paula thinks there's something wrong with your email address. Hot party chick, no. Okay, Lori. Okay. So the email itself looks pretty professional, but that email address is sending a message that Trisha may or may not want to send. Weird job title, email address. Okay. Marketing extraordinaire. Yeah, I don't know if that's her actual job title or not, but make sure that your email address is appropriate and professional. Being a hot party chick doesn't mean necessarily that you're a good or bad person, but it portrays an image that you may not want to portray in a business setting. So make sure your email address is professional. Okay, one last one, and this is the hardest one. I need somebody with really good attention to detail to see if they can see any problems with this email or any errors. Lori says what the presentation is talking about. They named the wrong receipt. Kaylee, you got it. Mr. Thompson and Mr. Thomas. Okay. So that's really hard. That's something really minor that you might not even think about. But the email is addressed to Brian Thomas, and the salutation or the greeting says, "Dear Mr. Thompson." So probably one of those is right and one of those is wrong. And just paying attention to those little details, you know, making sure you're addressing it to the right person. I've inadvertently sent an email to the wrong person. As I'm putting in the to on an email, it will autofill and I won't double check that. So there's just small detail, double check, proofread, make sure that everything you send out is very professional. All right, thank you everybody. So let me show you this scenario and tell me what would be an appropriate thing to do in this situation. So you wrote an email message expressing anger about your supervisor and sent it to a coworker. A few days later, that coworker admits that she accidentally forwarded your message to your supervisor and your supervisor's boss. What do you do in a situation like this? You've done something probably wasn't appropriate. You didn't intend for your supervisor ever to see it. But they did. Thank you, Kaylee. Kaylee says, call your counselor and pray. I love that. Some people might think that this is your coworker's fault. you shared something with them in confidence. You didn't intend for it to go anywhere else, and it did. But this is a situation that I think you really need to own what happened. And I think we've got some comments in the chat box saying that too. First, I call my supervisor, probably need to clarify. Lori, excellent. Kathleen, happened to me before, but the other way around. I was upset, but I got over it. Kathleen, I'm curious, did that employee talk to you about it? Or did they just kind of pretend it never happened? Jenna says, own it, consider the appropriateness of venting in such a way. Love that, Jenna. Yeah. I would like to share with you that supervisors are people too. Everybody makes a mistake, and actually owning up to your mistakes or learning something can endear you to your supervisor. So coming clean and talking with them and saying, man, I was having a bad day. I wrote this email and understand that you got a copy of it. I'm so embarrassed. I know it was inappropriate. I hope that you will forgive me, and you can be assured that this won't happen again. Actually might increase the relationship and deepen that relationship. So admitting, owning our mistakes, always the best way to handle it. Okay, talk to the supervisor, be honest. This is from my boss. This is Kathleen's follow-up. Thank you. She included the coworkers. The coworker came up to me and asked what that was. Why is she doing this in front of the coworkers? Something they didn't need to know about. That's a great point too, is when you're handling sensitive situations like this, you do it privately. You don't do it in front of other people. Yeah, very good point, Kathleen. Awesome. Whoops. Jumped ahead of myself. Just wanted to talk also a little bit about social media. Social media, we might use it for our work. We probably use it personally for our social life. But we just need to be aware that we are putting information out into the world through our social media posts, and make sure that it's appropriate and it's professional. In a recent survey, 77% of recruiters said that they run searches of candidates on the web to screen them, and 35% said that they've eliminated a candidate based on the information that they uncovered. So be especially careful about posting personal information on social networking sites. So-called privacy settings aren't always effective. Healthcare companies are instituting new policies to govern their employees' use of social media. True story, a prospective employee, a friend of mine shared this with me. He said a prospective employee at the company I work for had just passed an interview and was told that all he needed to do was to pass a drug test and a physical, and he would start on Monday. Someone found that candidate on Facebook, and the guy had posted 20 minutes after his interview, does anyone know how to pass a drug test in 24 hours? And the offer of employment was rescinded to him. Another individual said, a girl I know was a nurse at a hospital and got fired for posting things on Facebook, such as, so sleepy here in the ICU, will someone please code and give me something exciting to do? Now, I'm sure she was kidding, but that sends out a message that portrays an image to our employers of us, and so just be very careful about what we post on social media. Got some comments here. We got reminders not to post anything in regards to where we work, because it's like we speak for, we're the spokesperson for the company. Thank you, Kathleen. Absolutely true. Yeah. So this is a post, a social media post that I found in July of last year. So these are some health aids. This is a picture they posted on social media, and the caption was, felt cute, might drop your grandma later. So give me an appropriate or inappropriate. Do you think this post was okay by these health aides? Fully inappropriate, Kaylee. Yep, absolutely. In more than just the message. Yep, not okay, rather insensitive. Absolutely. That's a Hoyer lift. If you're not familiar with that, they were working in an assisted living facility and just kind of goofing around. Is totally inappropriate, and both of them lost their jobs. Totally not cool. Yeah, absolutely. So this happens all the time. I'm running a little behind here, so I just want to share quickly the last topic, and that is when we are treating patients and working with clients who might have a language barrier and how that can be detrimental to the care that they receive. So having a language barrier is shown to impact the access to health services, from having health insurance to receiving basic preventative and specialty care. It may jeopardize the patient's understanding of their diagnosis, their treatment, their follow-up care, diminish the quality of care that can lead to serious complications and poor clinical outcomes, and increased health care costs due to inefficiencies such as unnecessary testing. We live in an incredibly diverse state. There are over 100 languages spoken in the state of Alaska. So when you have that language barrier, it's very challenging to communicate effectively. Fortunately, we can have language assistance services. This might not be available in every location, but if possible, interpretation can, an interpreter can come and help. So that's someone who translates from one language to another as it is being spoken, so an oral translator. Someone who's a interpreter, excuse me, needs to have strong listening and speaking skills and needs to be trained to do that. Translation is something that's used for written messages. So having our forms and our pamphlets translated into different languages. And someone who can do that would need to be trained both in reading and writing skills in both languages. And we can translate intake forms, consent forms, patient education materials, and things like that. So when should we provide those interpretation and translation? So if patients have a limited English proficiency, either reading, writing, speaking, or understanding, that would be a good time to do that. If they have a hearing loss, difficulty understanding conversations, instructions, or communication with anybody in the healthcare team. And they need to be professional and trained in this. I don't know if any of you remember, but back in 2013 at Nelson Mandela's memorial service, President Obama was speaking, and there was a sign language interpreter behind him. It was found out that that person was not properly trained and was not using sign language. They were faking it. And it was brought up by people in the audience and viewing that he wasn't trained in sign language. And it's amazing that somebody could have gotten that far and not have the proper training to do the job that they were employed to do. So make sure that those who interpret and those that translate are trained. The use of untrained interpreters, including family members, should be avoided if possible. I know sometimes it's not possible, and we have a lot of children interpreting for their parents, but if there is another option, that's the better way to go, because there could be a conflict of interest or mixed agendas, or children sometimes may feel uncomfortable sharing with an elder certain types of information. So be on the watch out for that. I'm gonna speed through here. so we can finish on time. So if you're working with an interpreter, watch the patient, not the interpreter. Have that emotional intelligence radar up so you can see, are they understanding? Make sure that you're speaking slowly, clearly, using simple language, explain medical terminology, let you read the points on there, but make sure that the patient is understanding what you are communicating, and ask them to repeat the instructions so that you can verify that. All right, I'm going to skip to the end because we're out of time here, but some good questions for us to encourage our patients and our clients to ask in a healthcare setting is, what is my main problem? You want them to understand what is the concern that they're there for, what do they need to do, what are you asking them to do, and why it's important for them to do this. So good questions to ask. Make sure that our clients and patients have the answers to those questions before they leave. Some universal precautions. It might be hard to identify patients with limited literacy skills, so adopt universal precautions and approach every situation assuming that your patients may have difficulty understanding health information. Simplify all communication and confirm comprehension for all patients by asking them, you know, what do you understand from what I've explained to you? What are the next steps here? What, you know, if there's medications, have them explain to you what they understand about their medication and how to take it. So I know I'm running a little over. Thank you so much for attending our last Brown Bag series. We've really enjoyed providing these webinars for you and hope that you've found some valuable information in them. If you would like access to recording of any of these, please shoot me an email. My email address there is up on the screen, teresaN@alaskapca.org. And everyone who's attended will get a short survey next week. We really would appreciate you taking a few minutes and filling out the survey to let us know if these webinars have been valuable to you, if there are any other topics that maybe you would like us to offer in the future. And we will absolutely take your information that you share with us into consideration as we move forward. So have a great day, everybody. It was so nice sharing this time with you, and I hope to see you again in the future.